Today, we're going to talk about something really important, a message that your body might be sending you. It often feels like chest pain, but here's the twist. It isn't actually a disease. It's a signal. We're talking about angina.
So what if we looked at this differently? Instead of just a symptom, what if we thought of this pain as a pretty sophisticated warning system? A message straight from your heart telling you it needs some help. And honestly, understanding that message is the whole key to responding the right way.
Here's how we're going to break it all down in this explainer. First, we'll define what the signal actually is. Then we'll figure out where it's coming from. After that, we'll learn how to decode it, how doctors confirm it, what the plan is to respond to it, and finally, what the long-term outlook really is. Okay, let's jump right in. So, first things first, what exactly is this signal? Well, the official medical term for it is angina pectoris. Let's get into what that really means. Okay, that's the textbook definition. A bit of a mouthful, right? The key phrase you need to know is myocardial ischemia. It's just a technical way of saying the heart muscle isn't getting enough oxygen-rich blood. And this usually happens when you're exerting yourself, because that's when the heart has to work a lot harder. You know, the easiest way to think about this whole thing is to picture a plumbing problem. Your coronary arteries, they're the pipes delivering blood to your heart muscle. But if those pipes get clogged up or narrowed, the flow gets restricted. So when your heart needs more blood, like during exercise, it just can't get enough. And that pain signal, that's your heart basically crying out for more oxygen.
But what's causing that plumbing problem to begin with? Where does the clog come from? Let's trace this signal all the way back to its source.
Well, first, the demographics tell us a pretty interesting part of the story. It turns out that men are twice as likely to experience angina as women, and it's most common for people between the ages of 60 and 70. The main culprit, the primary cause of this whole issue, is a process called atherosclerosis. It's a slow burn. It starts with a perfectly healthy artery where blood is flowing freely. But over time, things like fats and inflammatory cells start building up, creating this stuff called plaque. As that plaque grows, it narrows the artery, and that's when you've got a problem. The result? When your heart is under stress, it's starved of the oxygen it so desperately needs. Now, atherosclerosis is the cause in about 90% of cases, so it's the big one. But it's not the only thing that can cause angina. Other conditions can trigger that exact same warning signal. Things like a sudden spasm in the artery, issues with the tiny blood vessels in the heart, a stiff heart valve, or even being severely anemic. Okay, so we know what the signal is and we know where it's coming from. But how do you actually recognize it when it happens? Let's talk about decoding the specific features of this very particular kind of pain. You know, doctors have a simple but really powerful tool to help them decode this signal. It's a 3-point checklist based on official guidelines from NICE in the UK. They look for 3 main things. Number 1, the feeling. Is it a constricting discomfort, like a pressure or tightness? Number 2, the trigger. Does it show up when you're physically active? And number 3, the relief. Does it go away within about 5 minutes after you rest or take a special medication called GTN? And here's the really clever part. How these features add up tells a story. If all 3 boxes are checked, that points to typical angina. If only 2 are checked, that's considered atypical angina. And if you only have 1 or even none of those features, it's likely non-anginal chest pain. It's just a really logical way to sort through all the possibilities. But, and this is so important to remember, the signal doesn't always feel like a classic Hollywood heart attack kind of chest pain. Especially for women, older adults, and people with diabetes, that message might show up as something totally different, like weird fatigue, shortness of breath, or even just some discomfort in your stomach. It's the same warning, it's just speaking in a slightly different dialect. So once a doctor suspects that this signal might be angina, how do they confirm it? This is where the real detective work, the diagnostics, comes into play. One of the most common things that can feel a lot like angina is actually GERD, or severe acid reflux. But this comparison makes the difference really clear. See, angina is triggered by exertion. GERD is often triggered by food or just lying down. Angina feels like pressure or squeezing. GERD feels like burning. And finally, angina gets better with rest, while GERD gets better with antacids. These details are absolutely key. Beyond just talking about symptoms, doctors follow a really clear path.
The first big test is usually a CT coronary angiography. It's a specialized scan that basically creates a 3D map of the heart's arteries. It's plumbing. If that's not totally clear, they might use other kinds of imaging to see how the heart actually functions under stress. And sometimes that can lead to a more invasive procedure to get the final definitive answer. All right, so the signal is confirmed. Now it's time to put together a response plan. And the goal here is twofold. Manage the symptoms, sure, but more importantly, address the underlying plumbing problem. The response plan for what's called stable angina is really comprehensive. It always starts with lifestyle changes. Then, medically, the toolkit includes things like aspirin and statins to help protect the arteries, a GTN spray for immediate relief if an attack happens, and daily medications like beta blockers to prevent attacks in the first place by just reducing the heart's workload. So what happens when you actually listen to the signal and you follow that response plan? Let's take a look at the long-term outlook. First, it is so important to understand why this all matters so much. Ignoring the signal can have really severe consequences. If that blockage gets worse, it can lead to a full-blown heart attack, dangerous irregular heartbeats, heart failure, and in the absolute worst cases, sudden cardiac death. This is exactly what we are trying to prevent. Now for the really good news. With proper medical management, the outlook for people with stable angina is actually really good. The annual mortality rate is typically less than 2%. This just proves that listening to the warning and taking action really works.
But, and I have to make this crystal clear, that good prognosis is for stable angina, where the pattern is predictable. Unstable angina, where the pain is new, getting worse, or happening even when you're resting, that is a medical emergency. That's a much louder, much more urgent signal that a heart attack could be right around the corner and it needs immediate help.
So when it all comes down to it, angina isn't the disease, it's the messenger. It's an incredibly effective warning system that's designed to get your attention before a catastrophe happens. So the real question is, your body is talking. Are you ready to listen?